a senior consultant gastroenterologist of this country and practicing gastroenterology for last 3 decades. And I'm a doctor for more than 43 years now. And this is today is a very important day, World IBS Day. This is a day on 19th April, and we celebrate this day to make a IBS person very aware that what is this disease, and whether you do have IBS at all or you have a different disease, and then if you have a disease, then how do you treat yourself and how frequently you go to your doctor and get treated by them very competently. So IBS, all of you know, must be knowing by this time that this is a disease which happens in abdomen. It's a chronic disease. It happens around 10 to 15% of whole world populations, and Indians also, we do suffer from the same. We have pain in the abdomen. There's an altered bowel habits, mostly pain in the abdomen with a diarrhea, or you have a constipation. You can have alternate of these two, which goes on for months to years. And it does not cause any other disease, it does not cause ulcer, it does not cause cancer, it does not cause weight loss. So this disease is really terrible in that you don't die of the disease, but you do suffer. And it is the commonest cause of absenteeism. Not only absenteeism in the office, but you also miss the social occasions. You don't feel good to attend a marriage, don't feel to attend your son's birthday, or you don't celebrate after India win the World Cup or any other cricket matches, or even after a good movie, you don't enjoy it and celebrate that. So, but let me tell you, the concept have really changed over last 6-7 decades. What is IBS? Now, we used to tell all IBS 50-60 years back are not classically irritable bowel syndrome. So why this has happened? Now, initially we thought that IBS, the cause of IBS, irritable bowel syndrome, is in the mind. It's a mental disorder, and the colon contracts. That means your large intestine contracts, and that's why possibly you have the pain. And that was the concept, and we used to treat patients like that. But now, over a period of last 6 decades, we have understood that there's a little brain in the gut, in the intestine, which is called enteric nervous system. And this enteric nervous system is well connected to the central nervous system and brain, as well as you have a lot of microflora. These are the bacterial flora within the small intestines and large intestines, and they decide our happiness. Means they maintain the nutrition, they maintain the immunity, they maintain the health in our body. So your happiness does not remain within your heart, your happiness remains in the gut. So your gut is happy, you are overall happy. So when there is a disbalance in the gut microflora, there is a problem there. There's an inflammation in the GI tract, and there is a immunological disturbance, there is infections, and ultimately there is a neural stimulations, and you get a pain in the abdomen with either loose motion or constipation. That's why the IBS starts like that. Now, how do you diagnose irritable bowel syndrome? As I said, that it's not a cancer, not an ulcer, you don't lose weight. But a person develops anemia, develops a pararectal bleeding, develops a lump in the abdomen, or fluid in the abdomen, or really do not feel any appetite, develops anemia, and then one suspects there must be something more to it, maybe a pancreatitis, maybe a colonic cancers, maybe some other disease including the tuberculosis in our country. So these alarm symptoms are very, very important. In a patient, suppose a patient is suffering from IBS for 20 years and something new like this comes, then one has to think of IBS, not this is something else. Now, how do you diagnose this? This is initially 50-60 years back it was by exclusion. Now we don't diagnose IBS by exclusion. We have positive tests for irritable bowel syndrome. Like in a diarrhea, we have anti-CD20 antibody. So anti-vinculin antibodies, these are marker of irritable bowel syndrome with diarrhea group. So we can diagnose irritable bowel syndrome by doing that. Now, how do you treat these persons? We treat them, initially it was the diet, anti-psychotic medication, anti-painkiller, anti-spasmodics. But we know now, we give rifaximin for diarrhea, we give for constipation like flucalopride or some other drugs also. In the psychological part we also handle, and for the bowel flora we can use probiotics. So ultimately for an IBS patient, you are not dying from this disease, but you have to be very good in touch with your doctor. You must be aware of the health and medical literatures. Your food habit should be right, like you should avoid the gas producing food that we are not able to discuss is a low FODMAP diet, which we don't have much time. And keep yourself healthy, do a lot of physical activity, stop smoking, stop alcohol, and think positive, and you will win your IBS and meet your doctor regularly.